Hello everyone, today's video is about blocked tear ducts, or as I like to call them, congenital nasolacrimal duct obstruction, or NLDO. So this is extremely common. In fact, in brand new newborns, it happens in at least 6% of the time, and over the first year of life, children can present with this up to 20% of the time. 20% of children can have it in the first year of life. So what happens is when the baby's forming, the nasolacrimal duct goes from the eye to the back of the nose so that any excess tearing falls down that little tube and into the back of the nose and dealt with or reabsorbed or even further down the back of the throat. So as it's forming, it starts at the top and works its way down. So with a blocked duct, what's happening is it's sort of a blind pouch. There's a tube, but the bottom has not opened up yet, and it generally will over time. Most of the time, it will open up by 6 months of age. Now, if it hasn't by then, the odds start to go down, and if it hasn't opened up by 12 months of age, it almost never will. So we will make a referral for your baby to a pediatric ophthalmologist if it's not opened up. Usually I refer around 9 months. So there's a little bit of disagreement over should you just go ahead and get it done, because a lot of the ophthalmologists can probe that blind pouch. If without general anesthesia, they can do it in the office if you do it before 12 months. After 12 months, most of the time they do have to use general anesthesia. So that is one part of the equation. The other part is, though, what if it does finally open up and you could save a procedure altogether? So there's not necessarily a right or wrong answer there, but different pediatric ophthalmologists have different opinions about that. So I usually refer around 9 months if it's not opened up by then. So I want to make sure you understand this is a different thing from an infected or a cyst that actually does need to see pediatric ophthalmology more urgently. So the blocked tear duct is just a dacryostenosis. The cyst is a more serious thing called a dacryocystocele, and that requires urgent pediatric ophthalmology intervention. So what we do for the blocked tear duct in the newborn is just a warm, wet washcloth. What happens is these excess tears will sort of make crusties on the eyelashes, and when you look at your baby, if there is a blocked tear duct, you may see an increase in the tear pool. That means you'll look at their eye and you'll just see tears sitting there in their eye because they're not draining properly. Since that tear duct is blocked, they can't drain that fluid down to the back of the nose. So what we do is a warm, wet washcloth to wipe it out, and then we massage. So if you were massaging your baby's blocked tear duct, you would want to put firm pressure starting at the inside corner of the eye and massage down along the bridge of the nose, and do that and just kind of rub up to down like that, and several seconds, several times a day. And that's supposed to help sort of push that fluid down and encourage opening of that bottom end of that little tube that's clogged up. You want to make sure that your fingernails are trimmed short, and of course wash your hands before you do this. With a blocked tear duct, the reason we can tell the difference between that and true pink eye is with blocked tear ducts, the white part of the eye, the sclera, the conjunctiva, should not be injected. It shouldn't be bright red. So with traditional pink eye, the white of the baby's eye is going to be bright flaming red, and it's not with the blocked tear duct. Because sometimes with the blocked tear duct, they can still get some discolored, like yellow, green, ooey gooey eye discharge, and that's what can then crust on the eyelashes, and you can wipe off with the warm, wet washcloth. Now, even though it's not pink eye, sometimes we will use an antibiotic drop, because what can happen is all of those tears accumulating can just get some bacterial overgrowth because it's sort of a stagnant fluid sitting there. So we'll use an antibiotic eye drop occasionally if there's excessive gooey discharge. So if your baby has an increased tear pool, and this can often happen in bright sunlight or with a cool breeze, that'll make them produce excess tears, and then you'll know the tear duct's blocked because they can't drain down. So if your baby has this, I just want you to use the warm, wet washcloths, massage. It could occur at one eye at one point and then the other eye at another, both eyes at the same time, and it sort of comes and goes until we hope it just quits occurring as they outgrow it and open up the bottom of that tube, their nasolacrimal duct. So it's nothing to be afraid of. It is a very common occurrence in newborns, and I hope this information has been helpful to you so you don't have to worry about it, because it's not something that we're very worried about. As always, if you like this, please give it a like, and it would be very helpful if you guys could subscribe. And if you do have a newborn and you're looking for more information, this video will be placed in our playlist for babies, and there's a lot of other information available there as well. Thank you so much.